Good evening, I'm Haryanto Diman, live in the Straits Times newsroom. The latest from Singapore's multi-ministry task force on COVID-19, we are staying in the current preparatory stage. There are no immediate plans to loosen or tighten measures, and Singapore will continue to rely on vaccines and testing in moving towards becoming virus resilient. And here's the key takeaway from today's news conference: Singapore will only tighten measures as a last resort.
And as we have said before, we are shifting our approach. Our main focus is not just the daily case numbers, because many of them are vaccinated persons who become infected and they have mild or even no symptoms. Instead, our focus is on the smaller number of infected persons who need supplementary oxygen or ICU care. And this figure remains stable and under control. In the past, when we have a situation of such high daily cases, we would have looked to measures like a heightened alert or even a circuit breaker to control the infection. But we are in a new phase where we have a high level of vaccine coverage to protect Singaporeans, and we are now moving into a phase of living with COVID and becoming COVID resilient. And so we assess that there is no need to impose tightened restrictions. In fact, we would only revert to such a tightened posture as a last resort to prevent our hospital system from being overwhelmed. At the same time, we do not intend to make any new opening moves at this juncture, because there is a time lag between the onset of infections to serious illness. And so we want to take some time to monitor the situation.
The next phase of Singapore's national vaccination exercise is a booster program starting this month. It's aimed at two subgroups: those who are moderately to severely immunocompromised and those aged above 60 years and residents of aged care facilities. Immunocompromised people are recommended to receive a third dose of the same mRNA vaccine 2 months after their second dose. Seniors should receive a booster dose 6 to 9 months after their second dose.
On the need for booster doses for various subgroups of the population, it has recommended, and MOH has agreed, to administer a third dose to the following two groups as the first step. First are immunocompromised individuals, and this should start from 2 months after their second dose to ensure an adequate protective immune response. In the coming weeks, we will reach out to these individuals through their healthcare providers, as they would likely have regular follow-up with their doctors. So it's quite an involved exercise. We don't have a database of them and SMS them to invite them for third dose, but we have to reach out to them one by one through their doctors. Second group are seniors aged 60 and above, and residents in aged care facilities. The EC19V has recommended that they should receive a third mRNA dose 6 to 9 months after their second dose. As some of them has received their second dose in around March this year, so we will begin to invite individuals in this group within this month, the month of September. So all our uncle aunties out there, pachik machik out there, when you get your SMS invitation, please MOH recommend that you go to the vaccination center and get your third dose and make yourself stronger and more resilient towards the virus.
Even as Singapore achieves a high vaccination rate, regular testing remains key to identify cases early. For certain higher risk settings, the government has mandated rostered routine testing, but the task force said that regular testing should not be confined to these groups of people. The task force encourages everyone, including fully vaccinated people, to self-test regularly with the antigen rapid test kits, especially when participating in higher risk activities or attending large-scale events. The task force is also actively reviewing new kits for public sale and will continue to make such self-test kits more readily accessible. Meanwhile, to supplement regular self-testings, members of the public can make an appointment for a self-paid fast and easy test at the 20 quick test centres from next month. This can be to fulfill employment requirements or for an unvaccinated person to attend a mass event. Lastly, the task force also called for employers to play their part in making regular testing a new norm. The tripartite partners will discuss further guidelines to promote the more pervasive use of ARTs at workplaces and as a key element of business continuity plans.
Right, this is moving beyond all of these mandated testing requirements towards making testing a new norm and making testing more pervasive. We have already reached very high levels of vaccination. We are one of the foremost countries in terms of vaccination. We should now aspire to be a nation of testing, where testing becomes a way of life.
Meanwhile, giving an update on the clusters involving the bus interchanges, Director of Medical Services Kenneth Mark said it's likely to be a workplace transmission, though investigations so far have not identified specific modes of transmission. He added how infection had first been introduced to the bus interchanges is also not clear.
The epidemiological investigations so far have not identified specific modes of transmission, but it's highly likely that spread has occurred within the work environment, possibly due to mask-off interactions during rest periods at the bus interchanges. The preliminary phylogenetic test results do support that this is likely a workplace transmission event. How infection had first been introduced into the bus interchanges is not clear. But given the higher number of cases in the community presently, it is not unreasonable to expect that introduction of infection had occurred from the community. Perhaps some bus captains had gotten infected in the community, and they in turn infected other bus captains in the interchange. We've also seen some infected bus captains bringing infection back into their households and infecting their own household members. We have no evidence as yet of any passengers or users of public transport being exposed and infected. So the clusters still appear to be confined to the workplace at the bus interchanges. It will take the rest of this week for the situation to stabilize, and we anticipate that the number of cases from the interchanges may start coming down in the following week.
And a quick look at today's COVID-19 figures. There are 216 locally transmitted cases confirmed today. 56 were linked to previous cases and have already been quarantined, while another 51 were detected through surveillance. The remaining 109 were unlinked cases. Among the cases are 2 seniors aged above 70 who are unvaccinated or partially vaccinated and at risk of serious illness. Even with the spike in daily case numbers, the task force stressed that Singapore is now at a different stage in the battle against COVID-19. Here's the final word from Health Minister Ong Ye Kung.
We all need to take care of ourselves and take care of the people around us. The government, on our part, we do whatever we can. Vaccinate as many of our population as possible, embark on booster program, continue to trace, test, isolate effectively, rigorously, offer good health care to every patient who is infected, put in place and enforce the SMMs, but we will refrain from one of our most effective measures. We will try our best to refrain, which is circuit breaker and heightened alert. I think most of us, all of us, don't want to turn back.
For more on today's announcements by the COVID-19 Task Force, visit straitstimes.com, and you can also watch the full press conference on the Straits Times' YouTube channel. Once again, I'm Haryanthadiman. Keep safe and I'll see you soon.